Hey everyone, this is Paul from Ortho Eval. Pal, today I want to talk about sinus tarsi syndrome. Okay, now this is something that gets missed quite often. It doesn't happen with everybody who has an ankle sprain, but it's something you definitely need to keep an eye out for. Okay, so the first thing I want to do is talk about the location of the sinus tarsi. So if you take a look at the outer side of the foot, you're going to notice an ankle here. You're going to notice that the CF ligament goes here, the ATF ligament here, and there's this little space right here in the subtalar joint, okay, just ahead of the fibula, and this is where that sinus tarsi is. Okay, now what causes sinus tarsi syndrome? Well, it's most often seen with people who have an ankle sprain, so people who have plantar flexion and inversion like this have trauma to this area. Oftentimes people will chalk this up to an ankle sprain or chronic ankle sprain. That's why the pain continues in this area. Or it can happen with people who have a flat foot or a really pes planus type foot. And what happens is every time they take a step, the foot turns out like this as the foot collapses and over compresses this area in the sinus tarsi in here. Okay, and that can cause an irritation and a pinch to this side of the joint on the inside, and it can cause a lot of inflammation and ultimately some scar tissue formation. Now, folks will have the sensation that there's some instability in the ankle when they have this. That's not uncommon, and usually some sort of a pinching effect when they're walking and or if they're squatting and the foot comes up and out like that. Okay, so people who have a really tight calf will actually turn the foot out a little bit more and bring it up and cause more pinch. So with these folks, if they have a sense of instability and they're going to be on uneven ground, what I do is I may put them into a lace-up brace if it's an acute problem and they're going to be on uneven surfaces, just to give them that little bit of stability. But most of these folks go into an orthotic to help support that inside part of the arch so that it keeps this area open and not pinch every time. Okay, so I usually get folks into a flexibility program for the calf muscle and then put them into an orthotic. They usually do really well. One of the things I like to avoid are ankle circles, because number one, it puts a pinch on, it puts a strain on this tissue down here and then puts a pinch on the tissue when they come back up here. And I don't like to do alphabet spelling with this particular problem because again, we're causing irritation here and pinch here. So I really try to work on strengthening of the foot musculature and also the supporters of the arch on the inside, okay, so that we can keep that ankle in a more neutral position and avoid it from coming out to the side like that repetitively. Now, these folks will generally do well conservatively with an orthotic and with some flexibility and gentle strengthening in those comfortable ranges. But if they don't, surgery is very successful for people who have chronic sinus tarsi syndrome. So if you're a person who has had an ankle sprain and it's not getting better in a reasonable amount of time and maybe you feel a little unstable, we need to be somewhat suspicious of this, especially if 3 or 4 months have gone by and this pain continues in this area. It may not be the ankle sprain anymore, it may be a sinus tarsi syndrome. So that's sinus tarsi syndrome in a nutshell. If you folks liked today's video, please give us a thumbs up and please subscribe to our channel. Thanks.